There are now borders within borders in Europe. For Italians, there is no freedom of movement inside their own country. Only those with urgent reasons to travel will get a permit. There are now cases of the COVID-19 coronavirus in every region. Only China has seen more deaths.
They've made us sign a certificate declaring our reasons for travelling, where we've come from and our destination.
We haven't learned anything from China. We should have followed these kinds of rules before.
An outgoing country is being told to stay in. Here, police using loudspeakers urge everyone to keep behind closed doors. Overnight, the country's quarantine rules extended from 16 million people to all Italians, some 60 million. Travel between cities is banned unless for work, health or family emergencies. Any kind of public gathering is forbidden. And all sports events are cancelled. There are fines for those breaking the rules or up to 3 months in prison. Cafes almost deserted by day must now close at dusk. The Prime Minister said in Italy's darkest hour there can be no nightlife.
We can't allow this kind of occasion anymore because they're occasions for contagion.
Paramedics prepare to take another person to hospital. But those trying to save them could end up patients themselves. Doctors and surgeons in Lombardy have been infected with the virus.
But now I'm waiting for the swab because I had some symptoms and we had 2 colleagues that are positive. So I'm at home now and I'm waiting for the swab.
Dr. Stefano Magnone told us that in another 1 or 2 weeks, hospitals won't be able to cope with any more coronavirus patients.
Many hospitals is reaching the top of the capability for ventilators and ICU beds, and as well for ordinary bed in the wards. So the government right today published a new recruitment campaign of devices, of ventilators and non-invasive ventilation devices. So we hope that there will be as soon as possible.
For those without symptoms, one of the few places they can go is the supermarket, although only a few are allowed in at a time, so they have to queue, encouraged to stay 3 feet away from the next person in the line. Some airlines are cancelling flights to and from Italy. From the Vatican to Venice, Italy's iconic views are unrecognisable. This virus has left Italians wondering just what happens next.
Well, earlier I spoke to Professor Giacomo Grasselli, a senior Italian government health official who's coordinating the network of intensive care units in Lombardy. I asked him whether he felt what they were doing in Italy was really combating what was happening.
I think that what happened in Lombardy is just like a bomb that exploded, you know. So it's the region has a very high density of population. All those people come and go from Milan every day. They are connected to every part of Europe. The problem is that it exploded there, and before you can realize what's happening, you are like overwhelmed by the mass of patients. So hopefully in other countries it's not behaving like this. But what is very, very, very important for every country, and that's why the real reason why I'm doing this is that everyone must understand that if you are not very careful in controlling the spread of the disease, this disease will overwhelm your system, no matter how efficient, good, modern it is.
Your explanation to us of the bomb that was in Lombardy, the ingredients were such that you got hit very, very badly. And those ingredients don't exactly exist necessarily anywhere else.
That's one explanation. And also, I mean, the bomb it's worse than a bomb because, you know, a bomb is one event limited in time and in space. This is an event that, you know, keeps increasing and it's contagious. So, everything happens very quickly. if one had told me that in 2 weeks we would have created 500 new ICU beds or completely reorganized our hospital system, I would have said, okay, you're crazy. And it's happening now.
Is it possible, do you think, for Britain to suffer a bomb, as you put it? In other words, a sudden explosion of a real intensity of this outbreak?
Possible, it's possible. I think that you have the advantage of being late compared to us. So you're now realizing that this can happen, and it can happen in a rich and modern and well-organized region, okay? So and I think that everyone, I'm being contacted by several people and from all over the world who are asking us, what are you doing? How did you do it? And and this is a great advantage for you. So I hope that in other countries this is not going to happen, because they know that it can happen, and they have to get ready, to be prepared.
Professor Grasselli, thank you very, very much for talking to us.
Okay, thank you.
Well, earlier I spoke to Italy's ambassador to the UK, Raffaele Trombetta. I started by asking him how things were in his country at this critical moment.
Well, it's a difficult time for my country and for the Italian people. We are asking a lot of them at the moment. The decision that was made yesterday by the Italian government, of course, was not an easy one, but it was necessary. It was necessary because people need to know that they all have to contribute, they all have to do their parts in this. This is a battle that we can win only if we all act together.
But will people actually obey that?
I think they will. Of course, you can't be sure that 100% of the people will do that. But I think that people are now aware, as I say, of what is necessary and what they have to do. As for the Italians living in the UK, it's a large number, it's a large community. I mean, we estimate about 700,000. There is one thing that I also would like to say. There have been some, we have been informed at least, that there have been some sort of episode of what I would describe as discrimination against Italians. And of course we do not accept.
What kind of discrimination are you talking about?
Discrimination that, for instance, in some cases, schools were closed only because they were Italians. I mean, those measures applies to people traveling from Italy, no matter what nationalities they are from. But if you are Italians and you have lived here for many, many years and you have not been in Italy for many months or years, of course you are no different from any other or British or national living in the UK. So that is a discrimination, that only because you are Italians, you are seen as a risk, as a danger.
How hurtful is that?
Well, it does hurt, I have to say, and that's where we are particularly close to our citizens.
Ambassador Trombetta, thank you very much.
Italy's ambassador to London talking to Kathy earlier.